Because I own my own business, I don't have insurance. And Amy, working for the hospital, she's always carried our insurance for the past 6-7 years. And through COVID, she lost her job. And with that came the insurance that we were used to.
I do more of the planning, so I think I'm always the one that's kind of thinking something's gonna happen, we just don't know when. You're willing to pay a lot of money for that what if.
Traditional insurance was really expensive and we just couldn't afford them. The premiums were too high and it was outrageous for us.
I've got my MBA specifically with a healthcare emphasis also. And what was interesting is that I'm having all these classes talking about how we can do this better and how we can do this differently. And we talk a lot about, medical tourism and shopping around and competitive rates.
We were really interested in something outside of the norm because the norm wasn't going to work for us. We found CrowdHealth and thought we would take a chance on it because it was an alternative.
The philosophy and the concept made a lot of sense.
We were hesitant to begin with because we weren't sure, are they going to stand with us when we need help, and were they going to take care of us like they said they were? Everything was normal and we went to the gym and had a pretty good workout, and halfway through it is when my heart started to really flutter and I couldn't get it under control. And so that's when we knew something was abnormal and we needed to do something about it.
His heart just started having palpitations and his heart rate was up in the 230s and not coming down.
I was nervous. I mean, it didn't feel right. It didn't feel like my heart was stopping.
Because it wasn't going away, we decided to go into the hospital.
One of my biggest concerns was we just signed up with CrowdHealth and, this is a big deal. Currently, if we couldn't afford it and we have to go bankrupt, it means losing the business, losing the house, which displaces my son and, and our grandkids.
It's overwhelming. It's overwhelming to think about.
When I got looked at, the diagnosis was called SVT. Basically, the way to take care of that is to burn off a portion of your heart. On a scale procedures, for me, it was a huge deal. It was pretty scary. When we started getting the quotes, one was very expensive from their local hospital. That's where the stress really gets to you. You just don't know what to expect. You don't know what the doctors are going to say. You don't know what CrowdHealth is going to say.
I think the saving grace in it all was that we had CrowdHealth. So I remember, him going to the hospital and I kind of made a joke with him. I said, okay, I guess we're going to test this and we're going to see how this works because this is what we've got.
That's when we really started becoming real big fans of CrowdHealth.
We were asked to submit our quotes and we were like, here's what we're being quoted at this time.
Then they started looking at the quotes and saying, all right, we're gonna shop around and we're gonna do what's best for you and get the best quality care for you.
They sent us to Oklahoma City. I believe that it was about $20,000 for the procedure. They flew us out first class. We stayed in an amazing hotel. They had a advocate there for us to drive us around. They made sure that we had our meals covered. They made sure that Justin was well taken care of. They
really stepped up and made it a lot easier for me.
That was an amazing experience, but first and foremost was making sure that Justin was getting a quality physician to do the procedure. That was the thing that was, I think, on my brain. And I was nervous for him because I knew that he was nervous. After his procedure, the physician and his nurse called me into like a consult room. They told me everything that happened with the procedure. They said everything went fantastic.
It was completely successful, which was great. And all that was off my shoulders. I didn't have to worry about that anymore. Life is back to normal. I'm working. I don't have any restrictions. I am extremely appreciative of the transparency that CrowdHealth brought to this whole situation.
With the CrowdHealth model, It's amazing that you get everything up front and you can make educated choices as to where to get care and how much you're going to pay for that. The reality is that we're stuck in insurance world and policies and contracts, and people don't realize that they can step out of that.